Hi, friends. This is Dr. Kamepalli. I'm an infectious disease, wound care, and obesity medicine doctor in Georgia. I'm presenting a case in the series of patients' perspective in infectious disease, wound care, and obesity medicine as a combo, trying to figure out what the patient's understanding is and how complex care delivery is being done in end care of medicine that we are all in. And here is a case of a patient that I'm going to present. But I'm in Georgia. My Twitter handle is at wound physician, X handle, I should say now. And hashtag removing barriers to healing is my hashtag that I use. My website, nobadbugs.com. And conflicts of interest are nothing but removing barriers to healing for infections, wound, and obesity. But I'm working on a telemedicine solution that would help with these processes. That is my major conflict of interest. This is a nice 40-year-old female security officer who at the age of 39 had been admitted to the hospital after suffering with what was supposed to be either type 1 or type 2 diabetes, which was confirmed to be a type 2 diabetes, and has been taking medications, has suffered with complications of her overall metabolic health, including hypertension, mixed hyperlipidemia, GERD, and also TIA with stroke earlier in the year, and ended up being admitted to the hospital in September with the right foot that had gotten worse with ulceration that started 2 to 3 weeks prior to the hospitalization. She was on Toshiba and Novolog insulin, ended up having staph aureus and streptococcus in the wound culture, ended up being sent home on IV unison, and also later brought in for significant vascular intervention, with her having vascular intervention done with blood circulation improvement. Also, we did try to get her to get into hyperbaric chamber, but secondary to insurance and payment issues, we were not able to get her to go there. And we though started using something called as continuous diffusion of oxygen, which is new technology that is out there, which does help with the local angiogenesis and improvement of wound healing with continuous diffusion of oxygen. But sometimes it does cause heavy drainage. And secondary to that, we intermittently used lactate dressing that helps with pH monitoring and a pH improvement. Whereas in an infected wound, wound pH is mostly alkaline, and this dressing helps with improvement of the pH to bring it to lesser pH that was conducive for healing. And intermittently also continue to use the continuous diffusion of oxygen and ultrasound mist therapy we used. But as we were doing this, unfortunately, she had developed a Charcot foot, and also she had overall improvement in her health, but did also have an episode of congestive heart failure. Ended up in the hospital with some renal insufficiency too, but that recovered. So here is the foot at her presentation, where with necrosis and gangrene changes that was debrided, and it surely became ischemic and stable ischemia with IV antibiotic therapy. And she did have MRI showing soft tissue deficit and tendonitis, and also tendon involvement. And she did end up, as you can see here, her glucose in the blue is noted to be high, and basically even the creatinine ended up being also high, as you can see. And she did end up getting discharged, and you see here the x-ray wise she presented like that, but unfortunately had pressure on the foot, and ended up also had developing the Charcot foot. We ended up getting her a crow walker boot, and she was initially on insulin, and over time we got it improved. And if you're going to see some wound pictures, and here you see the wound after we initially debrided it, did the wound vac initially, and then ended up starting the wound care with topical oxygen therapy and also lactate dressing. If you see here the pH, generally it is more alkaline, and as it improved, the pH also improved, and we continued with active local wound care, removal of the devitalized tissue, and sequential debridement, exudate management, infection control. And you see the improvements that you're seeing here. And also you can see this almost healed up here by May 8th, 2024. And if you can see, we use a high touch platform of glucose monitoring and also ketone monitoring and food logging. And you can see once we taught her how to what her food does to her blood sugars, she improved. And at the end of the day, we did also end up doing a composition analysis, and which we hope to repeat down the road to show some improvement. And as you can see, give an opinion regarding, and I want you to listen to it.
Thank you for coming. Okay, so tell me about you.
So I've been a diabetic since I was 15 years old. They first diagnosed me with type 2 diabetes. When I was 15, my father died in a diabetic coma, but he never really knew that he was a diabetic because he didn't come to the doctor. So he ended up passing away, and I got tested, me and all my sisters. And so from that point, insulin from the beginning of pills, 4 shots a day. Of course, 3 meals a day, and then I took a long-acting insulin. Metformin, so I couldn't take that from, so they put me on really bad. So my sugars were always 3, 4, 500, like they was the normal for me. But I really couldn't tell if it was high or low unless I checked it. But every time I would be sick and go to the emergency room, and I guess,
Okay.
so then, like my whole life, I've just been on insulin. It's never been working until I came to you. And then, I think in general, you can change things around as long as you eat the right foods and not, like I just started foods or soups, like
So, initially in the chart when I met you, they were talking about possibly type 1, type 2, there was some confusion. And so since you started at age 15, you started getting insulin and they were confused whether it was type 1 and type 2. And what job were you doing before we met in September last month?
I was a secure for like Allied University. Worked a lot of hours all the time. So
You did not see any problems with foot numbness or anything like that?
no, because I found out that I had neuropathy as well. So it was like sometimes I could feel like the tingling and sticking, but not really. Um, I just thought that I had stepped on something.
And how long was the sore on the foot?
Maybe 2 weeks it spread so fast because of my diabetes and not being controlled.
And you were on insulin and all that when you were in the hospital. And then the foot had gangrene and all, and so lucked out that it came out and it was dull in the bottom, and the plan was to get some blood supply. So what happened since you got? So when was it we met first? It was September or
It was in September.
Oh.
September the
23rd.
23rd.
Okay. And then we ended up after they did cleaning out a little bit, they sent out and our vascular doctor opened up the blood supply.
Right.
And the journey since during the hospital stay, what were you going through?
I really didn't know, like, in general, like, if I was gonna, like, because I've never been down, like, I've always been working and, being independent. So, like, in my head, I was just like, I don't want my food cut off, it was really, like, I guess, I don't know, like, it was hard because, you're not used to it and I'm young, so, like, at the time I was 39. And I'm like, I'm too young to have my limbs cut off. Over time, you hear how bad diabetes can be, and nothing ever happened to me. And just to rewind, I also had a stroke in 2023
Okay.
because of high blood pressure. So that happened in April. I was healing from that, and then my foot, like, I don't know what I stepped on. That, you understand.
It's hard to know that because of your neuropathy and everything, it's hard. And how many times were you admitted to the hospital before holding, or you did not understand what your food was
Right.
doing to you.
Mm-hmm.
So tell me what happened after you came and after you got, what did we do in the office here?
Making, like I check my sugar every day, and it does help. Like if you check your numbers and you change your way of eating, I guess to have somebody look at your numbers and say, okay, this is too high. Like when are you eating? Is it somebody that can call you? That's very helpful for people to, call and check on you and your numbers. So eating right plays a big part in the healing process.
Now you know that?
Yeah. I know that now.
But what happens? So what is the difference that you learned? What did we teach you here that made a difference? What were you eating before that you are eating, not eating now?
Like grits. I ate grits. Like I've never been like since I found out I was a diabetic. I never been like sweets and stuff. Like I stay away from them in general. I really don't eat a lot of bread. Like if I cook cornbread maybe, but then I didn't know that also. I didn't know that it affects you. So like the vegetables, like the chart that you gave, like what vegetables and fruit that I thought I could have. I really can't have the fruit. So just the vegetables and like the protein, like high protein, low carb.
So how much insulin were you on before and how much are you on now?
So I'm currently not on anything. Thank God. My A1C went from like a 14.9 to 7.2, and it's always been like 11 to 14 before I get about what you can have and what you can. So I'm just thankful for that.
So another thing is that basically you had a foot problem, and initially we had a huge. But the problem is now because of neuropathy, you developed a Charcot foot,
Right.
and then not what we wanted, but
Right.
at least we have a leg to walk on.
Right.
And then the goal now is for you to understand how to eat and what that food is doing to you. That is very important. Tell me difficulties that you're facing when you eat food.
Like I know I have to eat right. So like what I normally would cook and eat, like it's not the same. So it's like sometimes I'm like, okay, I don't really want to eat this, but I know I have to eat.
Why do you have to eat things?
Um,
And if you're not hungry, why do you have to eat?
I just feel like I guess I don't know. I just feel like my numbers are gonna like my sugar is gonna drop lower. Like just say for instance, if I wake up and I'm like my sugar is like 118, like I'm like I have to eat. If not, then it keeps dropping lower.
Okay.
So sometimes I still don't want to eat at that
Did,
time.
did you talk about low carb and carbohydrate restriction as a dietary lifestyle? And we talked about the insulin
Right.
and insulin optimization.
Right.
And sometimes you still sneak in some rice and
Right. I did, and I saw that it elevated my sugar like a lot, just by like a half a cup of rice. Me thinking, okay, that'll be okay, but it's really not okay.
so the idea is documenting. It's not about what I teach you. It's not about fasting, feasting, or timing. It's about tracking and taking ownership of your health. So what I gave you is a glucose and ketone meter,
Right.
and ask you to track it and invest at the time in it, because you can you can you can get over these issues with diabetes. It's all about understanding and taking ownership. And this is a journey. It's not like you can just get over it just because you have an over it shirt. Okay, so but the mindset is good. You just have to take ownership. What is that you would say to somebody who's going through this process? Like when what happened to you when the moment I walked in the hospital and I talked to you? What did I tell you?
Wish that you would have caught me earlier or sooner. So explain to me everything, then that helped me out a lot because I understand more now than, you always like tell me things and I have to look it up and understand. So I like to understand what you tell me. So I kind of like do research on it all the time. But if it wasn't for you, like, just eating, like how you can eat right, like I never really knew, that could
We
change.
got you off insulin. We got it is we say we because without you putting the effort, nothing could be done. So, what is one advice or two advice that you give to the person that will likely have this problem?
I would just say, don't give up. Like if something happens, just eat right and try to keep track of everything that you eat so you can know what your numbers are. Because I don't know what my numbers are. Like I feel the same whether my sugar is high or low. So if I don't track it, then I don't know. But I would just say make sure that you're taking care of yourself and making the necessary life changes because like I'm 40 now, but I'm so young to be going through this. Like I've already had a stroke, and then like I've had this foot issue in the bottom like just a lot. So I would just say take care of yourself and track.
Listen, yeah, tracking the key is tracking and
Right.
taking ownership and understanding that we all have this monkey mind. Carbohydrates are very addictive and try to cut them down and try to work with your doctor to take care of them.
Right.
Thank you very much for taking time.
Thank you for having me.
Thank you for coming.
Thank you.
So basically, coming down to summary of what happened there is taking of a whole person in healing. That is what wound care professional. This whole person approach to the whole in a person really involves. We are monitoring, educating them, and also tracking them. As you heard her, she feared that her foot was going to be cut off. She was young. She had problems including DKA, TIA, and also the key in this whole process was high touch solution, which we provided, where we are able to counsel her but also track her and get some data regarding her food and ask her for her food logging data and then keep her abreast with intermittent calling with remote patient monitoring. And also, she understood finally that eating plays a huge role in her healing process. And she understood that eating foods like grits and bread that is normally eaten in this environment is not kind of a good thing. So, in healthcare nowadays, the concept of healthcare delivery has turned into something of a drug versus disease, whereas it has to be diet versus disease initially, and the lip service of healing has to improve. That is, we just have to understand that the from the in the acute care and chronic care disease processes, we are preventing the chronic diseases. Uh, only we can only prevent chronic diseases by preventing the people getting sicker. Now, at this point, what we are doing is we are doing the hard work when the people fall off the bridge, and we are trying to get them off the river after they fall off. We need to prevent them from getting onto the bridge of chronic diseases and try to make useful changes. And with that, I just want to share that my patients have been a significant experience for me, and I treasure each one of them, and particularly this patient. Thank you very much.